Okay, very good day to you. Thank you for taking the time to watch this short video. My name's Dr. Simon Wade. I'm the Webinar GP, founder and host of live and interactive weekly webinars at webinarsforgps.com. Been doing this since January 2013, so over 2 years now. Now, our next CME webinar, our Online GP CPD, is all about cardiology and valve disease. And it's all to do with how we as primary care physicians can manage and supervise and appropriately refer patients with cardiac valve disease, who to refer, who we can safely observe, who we can safely reassure. So I'm very pleased indeed that Dr. Yassir Javaid, who's a GP and a GP with a special interest in cardiology, is going to be speaking to us today. Now, I'll just tell you a little bit more about the webinar. So, as I say, it's on Thursday, the 7th of May this week at 8 p.m. British Summer Time. And Dr. Yassir Javaid, who's a cardiovascular disease clinical lead for both Nene CCG and East Midlands Strategic Clinical Network. And he's presenting on community aspects of valve disease relevant to primary care. And this module will cover the detection and screening of valve disease, appropriate surveillance, and identifying indications for surgery. And it will also cover the differentiation of physiological against pathological findings on the echo. It'll also cover patient education, what is valvular atrial fibrillation, and what is infective endocarditis. So the learning outcomes from this webinar, firstly, understanding the natural history of valve disease. Secondly, understanding the importance of timely referral for surgery. And thirdly, what are the new indications for antibiotic prophylaxis prior to dental surgery? So remember, the webinar is equivalent to 1 CPD credit. It should last about an hour, the session, including the Q&A. And obviously, if you can show impact when you write up your notes for your appraisal, if you can show impact, then you can double up the value of this CPD exercise to 2 credits. A little bit about Dr. Yassir Javaid. Dr. Yassir Javaid used to be clinical lead of a community cardiology clinic in Northampton for about 6 years, focusing on patients with heart failure and valve disease. He's an established GP in Northamptonshire, and he's also the cardiovascular disease clinical lead for both Nene CCG and in East Midlands Strategic Clinical Network. And when you register for the webinar, you'll be emailed a unique set of login details. That's how we organize the webinars. And remember, if you register but cannot make the live CME webinar, as long as you've registered, you will receive an email within a couple of days after the live session with a link to access the recording. And obviously you can then watch that at your leisure. So I'll just show you the registration page if you haven't already seen it. Let's see. Just going to share this page. So here we are on the registration page. The URL is webinars-for gps.com/next-CME-webinar-GPs-nurses. I think I need to shorten that URL, don't I? On this page, you can register for the webinar. So you've got some information there about the webinar. And here on the yellow button, that's how you register. You click that button to register. Now, if you want to try the £10 trial, if you're new to Webinars for GPs, why not scroll further down? You can register for this webinar as part of a 30-day trial. So you'll see here on the screen, it says click here on the big orange button, click here for your £10 for 30 days trial. And that would give you access to 4 live webinars and their recordings for just £10. It's a great way for you to try out CME webinars as a way of getting your online GP CPD. So we all have to do CPD, don't we? a minimum of 50 credits per year. Minimum of 50 credits per year. We have to do it. CME Webinars, I'm passionate about, because it's the modern smart way to do your CPD. So you save time and money, and no hassles. So no hassles at all. You do your CPD from home. You know, you get home, bit of catch up with family, bit of food, and then you can settle down and take in the webinar, do your feedback and learning points afterwards, and there's no traveling home again. So it's really smart, really efficient, save lots of time, and time is money. So I hope you'll join us on the webinar. Thank you for watching this. My name is Dr. Simon Wade, the Webinar GP. Find out more at www.webinarsforgps.com, webinarsforgps.com, and I hope to see you on a live webinar very soon. Bye for now.